What successes and what challenges have you had with managing and treating your IBS?
Well, my challenges were coming to terms with I have this and I can take control of this, and finding the people that fit on my team that are going to help me do that. I spent a lot of years trying to get my team together. And there's that saying that it takes a village. And that's no different with any disease or anything that we have, that it truly takes a team, a village of people to help you meet your goals. And in this case, have a quality of life. And I feel like it wasn't until I got all of the right people on my team was when I could celebrate my successes. And I was able to have success because some of the people on my team weren't exactly what people would associate with having, you know, IBS is a condition of the GI tract, with people thinking that and not thinking that it's multifactorial, especially impacting, you know, the mind and the gut connection. So I sought out, I had a health coach that specialized with functional nutrition on my team, but also was trained with tools like mindfulness and meditation, and taught me a lot about self-care and how important that was with regulating my nervous system. And another person on my team that I went through and kind of go back and forth over the years to is a pelvic floor physical therapist. And that's not a term that a lot of people have ever heard before. When you hear physical therapist, a lot of times people think they're going to have me do hip or knee or foot exercises, but these folks are actually trained to help people in the pelvic floor, which actually makes up the place where these organs live that impact us. And then probably one of the other people on my team, of course, that's been the most important is finding that right provider for me that could help me understand my IBS and prescribe the right medication that was individualized for my needs and what I could do.
Thank you. Thank you for sharing that. I think you highlight that, and a lot of this is touched on in the some of the educational information on the website. Just all of the different treatment modalities, and I think so much of treating IBS is a little bit of it's just keep your feet moving, dancing, and always thinking ahead as to what levers can we potentially pull on in this particular person to help, from diet to mental health and behavioral health, which is very bi-directional. People with chronic GI conditions have a higher risk of developing anxiety and depression, and people with those psychological symptoms are also more likely to get GI symptoms. And so there's some very effective therapies to treat that angle and piece of things. And then diet, as you mentioned too. So those are a lot of really helpful tips for people who may be struggling and plateaued and they're getting better.